So he needs like new blood put in him, Phil?
Yeah. When we test his blood out of his arterial line, we can see that the amount of blood he has in his body is not enough. We're going to give him a supplement, basically, somebody else's blood. So his bone marrow inside his bones constantly makes blood, but because of his surgery and because of the leaking out of his chest tubes and because of the blood testing, us using blood to monitor different things, he's lost blood faster than his bone marrow can make. So it's not a it's a temporary problem. It's not like a long-term problem for him.
Yeah. That was my concern too, like in the meeting. I'm like, is he losing too much blood? Like, you know?
Yes and no. Like, it's what I would expect for somebody in his situation. Obviously, it's not ideal. Like, in a perfect world, he wouldn't have to get a blood transfusion at all. But even if we were like, let's grab this. I guess there's just no way around it. Like with how sick he is. And like there's risks to blood transfusion, but they're pretty low. And like the science and technology of like testing the blood for things and the risk of having a reaction to it is relatively low. That doesn't mean it doesn't happen, but the risk of not having a blood transfusion is
greater, basically.
Yeah, it's greater.
Benefit versus risk. It's more of a benefit than a risk. Correct. Getting the blood transfusion.
Exactly.
Okay.
Yeah, that's the best way to think about it. So this part of the blood, the red part of the blood, so this looks like blood, like how normal blood would be, but it's just only a part of the blood. It's the red blood cells. There's all different pieces and parts of the blood.
Yeah, there's plasma.
There's platelets, there's cryofactors, like different chemical compounds that do different reactions. This component mostly just carries oxygen around your body to your different tissues.
Right on the date it says 10/11. Is that when it was pumped out or later? Today's date is the 12th. And this is supposed to reflect when the blood was given, correct?
No. I'm not sure what that date is. That might have been a date that it was prepared, like maybe a couple days ago in the blood bank. This date here is the date of expiration. Here, I'll show you in the paper as well.
Oh, sorry.
Yeah, I'm assuming that this is the tech's initials and then the tech number, and then the date she prepared it in the bag from the donor pool. And then from the date she prepared it, she puts an expiration date based on the blood bank standards, which I'm not familiar with. Like, I don't know how they determine when they would expire per se. But this indicates that the blood was just donated 6 days ago.
Why nothing on here indicates today's date? Will it be indicated in the chart?
Yeah, I'm documenting like right now in real time that I'm giving it the unit number and all that. It actually never does have today's date because it's
given at random.
Yeah, it's like not how do I describe it? Like there's a bank of individual units made that are checked, and it's cross-matched to his particular blood type, and then sent to us from the laboratory sciences. But there's never like a specific date on the blood of when it's administered like a medication.
Yeah, because that's reflected in the chart. It's not reflected on the actual
Yeah, it's just not how it's done, I guess. I don't know how to describe that.
Yeah, basically, like, if you guys are not going to know when you guys are going to need to administer blood, so it wouldn't be indicated on the actual blood, but it would be indicated in the chart, like, you gave blood. Like, okay, I get you. Okay. Little O positive babies.
You know what your blood type is?
Yes.
Are you the same? You're probably positive.
You know you're supposed to eat and work out according to your blood type?